The flight of hope, fearing over 1 million doses of the COVID-19 vaccine, will touch down at JKIA. This marks a major milestone in the fight against COVID-19. How prepared is Kenya? What measures are in place to guarantee safety and vaccination of the most vulnerable groups of people? We tackle this and much more on today's edition of Front Row. With me, Aby Agina. Our hashtag for the conversation is Front Row. And to share your questions and of course your tweets, you can tweet us at KTN News KE. You can also tweet me at Agina Abi and my colleague at Akisa Wandera. Front Row begins right now, and I'll be introducing my rich cocktail of experts to help us drive this all-important discussion. Well, joining us at this moment, we have Professor Oyugi. He is a professor of virology at the Department of Medical Microbiology and Deputy Director at the University of Nairobi Institute of Tropical and Infectious Diseases. He holds a PhD in virology from University of Manitoba in Canada. Professor Oyugi teaches both undergraduate and graduate students at the College of Health Sciences. He also does research on emerging viruses. Next off, we have with us Dr. Mwachonda. Dr. Chibanzi Mwachonda is an experienced medical doctor with a demonstrated history of working in the medical practice industry. He is skilled in clinical research, medical education, epidemiology, medicine, and public speaking. He's also the current acting Secretary General of the Kenya Medical Practitioners and Pharmacists and Dentists Union, KMPDU, and holds a postgraduate certificate in leadership and management in health-focused in health and healthcare administration and management from the University of Washington. Well, before we clear up on our guests, we have Dr. James Nyikal. He is the current Member of Parliament for Seme constituency. He has worked in various capacities in government, such as Permanent Secretary in the Ministry of Gender, Children and Social Development. He's also served as the Director of Medical Services and Chair of the Kenya Medical Association. He was also a lecturer in the Department of Pediatrics and Child Healthcare, University of Nairobi between 1990 and 1992. In the 12th Parliament, Dr. Nyikal currently serves as the member in the Departmental Committee on Health. He holds a Master of Medicine, Pediatrics and Child Health from the University of Nairobi, as well as a Bachelor of Medicine and Bachelor of Surgery from the University of Nairobi, and a Fellowship in Newborn Medicine at Monash Medical Center in Australia. Kenya seems to be inching closer and closer towards its third wave, but there is hope with the COVID-19 vaccination in sight. Kenya's COVID-19 vaccines expected to arrive in the country later and will be distributed in 2 batches to all the 47 counties. According to a report seen by KTN News, the 1,020,000 vaccine doses are set to be distributed without delay to all the priority groups across the country. Our Health and Science reporter, Beldin Walieula, has more on what many see as a step towards the final containment of the pandemic.
Kenya's plan to vaccinate 30% of its population in 2 years is set to begin this week, with approximately 1 million people who will get the 1 million doses of the Oxford AstraZeneca vaccine procured through the COVAX facility under WHO. The first batch, which will have 495,000 doses, will be distributed to the 9 regional depots, level 6 hospitals, and military level 4 hospitals across the country. The remaining 525,000 of the doses will be distributed in the second batch soon after. The vaccine, which has to be stored within 2 to 8 degrees Celsius, will be ferried in special trucks to the regional stores, and those that need air transport will maintain the same cold chain temperatures. According to the ministry's COVID-19 National Vaccine Deployment Plan 2021, once cleared at the airport, the vaccines will be transferred to the central vaccine stores in Kitengela, and subsequently 441,000 doses will be distributed to the 9 vaccine cold stores in the country. The Eldoret Regional Vaccine Store will serve 7 counties in North Rift. Nakuru Store, 5 counties within the South Rift. Kakamega Store will serve 4 counties within Western Kenya. Nyeri, 4 counties in Central. Garissa Store will serve 3 counties within Northern Kenya. Kisumu Store will serve 6 counties in Nyanza. Meru, 4 counties. Nairobi Regional Store will serve 8 counties within its environs. And Mombasa Store will serve 6 counties within the coastal region. 6 national referral facilities are said to get 33,000 doses in the first batch, while 5 military hospitals are said to get 21,000 doses in the first batch. 1 vial of the vaccine, which has doses enough to vaccinate 10 people, should not be shaken vigorously and must be used within 6 hours of opening it. Those eligible for vaccinations should not have suffered COVID-19 infection within the 6 months prior the day of vaccination, have no fever. They should report any known allergies and provide written consent for the vaccination. The global rollout of the COVAX facility vaccines is expected to deliver 11 million doses over the next 7 days in what WHO says is the start of what will be the largest, most rapid and complex global rollout of vaccines in history. COVAX aims to deliver at least 2 billion doses of COVID-19 vaccines by the end of 2021, including at least 1.3 billion to the 92 economies eligible for support through the COVAX Advanced Market Commitment. According to the African Union, Africa expects 75 million vaccines between March and May this year. So far, Ghana has started its vaccination after Accra received 600,000 vaccine doses. President Nana Akufo-Addo led the country by taking the first shot. Ivory Coast got 504,000 doses as the second recipient of the vaccines in Africa, and Nigeria expects 3.92 vaccine doses. A study by Johns Hopkins researchers in mid-November 2020 shows that wealthy nations had reserved 51% of various vaccine doses, even though they are home to only 14% of the world's population. High-income countries currently hold a confirmed 4.2 billion doses, while low- and middle-income nations hold 670 million. Building Walyaula, KTN News.
From that report, we want to bring in our group science and health editor, that is Dr. Mercy Korir, who will be heading off to the airport where the consignment of the vaccines are expected to touch down any minute from now. Dr. Mercy, what is the roadmap, the landing and afterwards?
Okay, Abby, so the plane has been on air for about 1 hour and 9 minutes, and we'll be showing you shortly that it's still in the airspaces at the Middle East. But so we expect it to land in Kenya. Touchdown is 18 minutes past midnight. That's when we expect that the plane will have landed down, and we expect that from there on now the vaccines will make it, to the central vaccine stores. So you can see that it's just barely taken off from Doha. This plane started its journey from India, from the Serum Institute of India, where this AstraZeneca, Oxford AstraZeneca vaccines are being manufactured. And now, as you can see, the flight path, its destination is JKIA, Nairobi, Kenya, at 18 minutes past midnight. So we're keeping tabs on this plane to make sure that the vaccines actually land in Kenya, 1,020,000 vaccines, after which they go to the central vaccine stores in Kitengela soon after being cleared at the port. Then from there, the government has it in 2 batches. The first one, 495,000 doses, which the previous story by Beldin Waleula highlighted, and then 525,000 other doses later on to the level 5 and level 6 facilities. Of note here is that the vaccines vaccines are free at all level 5 and 6 facilities. At the very beginning, we expect that the frontline healthcare workers will be vaccinated, and this involves everyone who deals with the patient, everyone in a hospital setting. So it could be the watchman, it could be the cleaner at the hospital, the doctor. Everyone who works in a hospital setting is a frontline healthcare worker, and they've been lined up for this vaccine, after which now the government has a whole priority list of who will be vaccinated. And so this, of course, is a historic moment. From earlier on, we know that Ghana received its 600,000 doses of the COVAX facility vaccines. Ivory Coast, Cote d'Ivoire, received its just slightly above 500,000 doses. Today, Angola was the first country in the southern and eastern part of Africa to receive its COVAX facility doses. So as we can see, the COVAX facility set out a whole distribution mechanism. It's the largest of its kind through UNICEF, the WHO, Gavi, and the Coalition of Epidemic Preparedness and Innovations. So the target is 2 billion doses to 190 countries. Out of these, 92 are under the COVAX facility, where Kenya is one of those countries. And so we expect that within the next 1 week, 2 weeks, there'll be a lot of activity on the African airspace as we look at delivering these vaccines to those who need it the most. And as we heard from the other story, we've seen that initially, the West, which is home to about 14% of the world's population, had more than 50% of the vaccine doses ordered. So this COVAX facility actually is supposed to cater for those in the low and middle income countries like Kenya, who may not have the financial muscle to, negotiate and get these vaccines. And so this is a historic moment. This is a big time for Africa. It's definitely a big time for Kenya, a big deal for Kenya that these vaccines are coming in. It's all hands on deck. It's all systems go. And we expect that this vaccination program rollout that we expect will start anytime from Friday will run smoothly, and that everyone who deserves to get this vaccine, the jab, will actually get that jab, Abby.
All right, Dr. Korir, one of the big questions right now is the safety and the sanctity of the vaccine when it's arriving into the country. Do we know whether our facilities have the right infrastructure to take on the vaccines? Okay.
So initially, the vaccines are supposed to be stored under 2 to 8 degrees Celsius. So this is fridge temperatures. This is the usual routine vaccination temperatures that we know of. If you're thinking about your everyday childhood vaccines, we're talking about polio, we're talking about tetanus, all these vaccines are being stored under that. And that's why the country opted for the Oxford AstraZeneca vaccine, because we already have that infrastructure. So from the reports the government is giving us is that we are able to handle this. Our central stores in Kitengela is able to. The other 8 regional stores are able to store this because it's already within the existing routine vaccination programs. Those in the far-flung areas, we're talking about Garissa, Wajir, Mandera, Turkana, will have their vaccines flown there under those strict 2 to 8 degrees Celsius, so that by the time they're getting to the end user, they are still within that safety profile. Now, this I found interesting when I was talking to the head of the Vaccines and Immunization Program, that, the 1 vial of the vaccines has enough doses for 10 people. So once that is open, it has to be used within 6 hours. And so we expect that now, once the rollout starts, it will be, quick turnaround time to make sure that everyone is able to be vaccinated. Everyone who's been registered and has an appointment is able to get that vaccine, so that we do not waste any of those vaccines once the vials are opened.
All right. Very detailed reporting there from Dr. Mercy Korir. And clearly you can see from the flight radar that the vaccines are still airborne. They'll be landing in a few minutes, actually in a few hours, yes. And we'll be covering that for you here on KTN News, where you get the whole story. And I'd like to also get some interesting insights from my panelists at this hour. We'll be joined by Dr. James Nyikal, who is in our city studio. We also have with us Professor Oyugi, who is a virologist at the University of Nairobi. And we also have Dr. Chibanzi Mwachonda, who will be joining us. My colleague Sophia Wanuna also spoke to the Cabinet Secretary in charge of Health, that is Mr. Mutahi Kagwe, and we'll be also giving you some updates alongside that in a short while. But for now, I'd like to quickly take on my guests at this point in time, and I'd like to bring in Professor Yugi, who is joining us here live. And Professor, quite a momentous day for not only Kenya but East Africa. We shall be making headline as the first country to receive the vaccine in East Africa. We do know that a few other African countries have already received the vaccine. What do you make of this move by the government?
Thank you again. I think to all Kenyans, it's a great day for us because remember we are in a pandemic. COVID-19 has been spreading amongst our population. We have seen a lot of deaths. And remember, the only tool we can fight this virus is a vaccine. And I think the arrival of this vaccine in this country is going to help us reduce the number of those who are getting infected by the COVID-19.
All right. Dr. James Chinkal, if you can hear me, it would also be quite reassuring to Kenyans that once this vaccine arrives in the country, what are the safeguard measures we have so that we don't lose the vaccine at the warehouses? We do know that there are currently quite a number of cases being probed by both Senate and the National Assembly.
Well, I think the first most important thing is that the vaccines arrive and that the cold chain is intact, so that from the time it gets to the airport to the time it gets to the stores and to the people, the temperature remains the same. But I know you are referring to the safety measures that is not lost through pilferage. I think the government really should be able to take care of this. Why perhaps we have chosen the AstraZeneca vaccine, it has a system that it has been using for the other vaccines. So the storage that has been in those vaccines, that has been for those vaccines, will be used for this. The security measures will be the same. Obviously, we are concerned that there will be loss at the storage, but we don't expect this because at
all right, Dr.
moment,
Nyikal, we seem to have a small challenge with your microphone. We'll be sorting out shortly. And let me bring in Dr. Chibanzi Machonda from KMPDU. Quite a historic day for Kenya.
Yes, thank you, Abby. And truly it is a historic moment for the country. I mean, being amongst the countries in the sub-Saharan African region that is receiving these vaccines as part of the COVAX facility. So yes, indeed, it is a historic moment for the country. We've seen the plans that have been put in place, although we are also at a position where not all the plans have already been put in place in terms of implementing the vaccine rollout, and that is where we hope that these are issues that will actually be addressed so that we get to have a successful vaccination rollout and campaign.
All right. And Professor Yugi, listening to the two other colleagues in the line of your profession, the other major concern definitely is as regards to this vaccine, how will it be implemented in terms of the vaccination program? It remains a very guarded secret in terms of the schedule. Do you know if there's a list that the government will be following? And coming from your background, there are jitters really from Kenyans of all walks of life that have different kinds of understanding about the vaccine. How important is it for Kenyans to get the jab?
Thank you again, Mr. Agina. I think, remember, as I said previously, that we are in a pandemic, and this virus called COVID-19, we know that when you get infected, there is a possibility that you can actually die from it. And even in addition to using what we have been using, like wearing of mask, washing of hands, social distance, all those things are not helping, are not preventing us from dying from COVID-19. And therefore, I'm appealing to Kenyans, those who are going to be lucky to get this vaccine, to go for it, because this is the only tool that is going to protect you from getting serious COVID disease, as well as saving your life.
All right. Dr. Nyikal, we have you back. I'd like to get your reactions really in terms of the rollout program. We do know that we are receiving close to 1 million doses, and sitting in Parliament, what is the official position in terms of who will be getting the jab first?
Well, the official position is to be worked out by the ministry. But what I know from my position is that you will start with people who are exposed, mainly people who are working in hospitals. Those should get them first, whether they are doctors, nurses, subordinate staff, they should get those first. Then after that, people who are exposed, we work in places that are congested. Teachers, for example, would also be vaccinated. That is in my view. Then policemen and people who work in prisons, I think they should also be vaccinated. And then you should also look at people who have coexisting conditions, such as diabetes, hypertension, cancers. Again, they should also. But it is the ministry to put on a clear criteria of who is getting the vaccine and in what order. I presume they'll have phases where they start with this group, and that group. That is something that I expect them to put in place.
All right. And Dr. Chibanzi, do we know of any official document that has outlined how the vaccine will be administered?
Well, I think we all appreciate that the Ministry of Health has been working on this. We've seen the deployment plan, but unfortunately when it comes to healthcare workers being the first target group and being a group that is essential, not just the healthcare workers, the frontline workers, we also have the teachers in there, we have the forces, the security forces, who are also handling part of this response, is that there is no elaborate communication, there is no elaborate sensitization, there is no elaborate education on how the vaccine is going to be rolled out. And more importantly, there are very critical issues that have not yet been addressed. And as Prof here has alluded to, vaccine hesitance is real. So if we think, and even amongst the healthcare workers, it is there. So if we think that because healthcare workers understand vaccines, they will basically just take it up easily, it is not going to be the case. In fact, for healthcare workers, it gets worse because they do understand even the adverse effects. And so it's very normal for healthcare workers to look at, and even for doctors to look at it from a point of, what if I fall on the other side of the adverse effects? And when it comes to the adverse effects, what happens if you get the adverse effects? Where do you get treated? Who's going to cater for your cost of treatment? So these are real concerns that healthcare workers have, and I think the ministry then has a lot of work to do. The deployment plan has been very elaborate in terms of advocacy, but that is not really happening, and the vaccine is already landing. And given the time frame it has, then it has to be deployed and administered immediately without further delay. We don't want to see a situation that happened like what happened in South Africa, where at some point the vaccine was actually getting to expire and it had not yet been administered.
All right.
Administered, yeah.
Well, gentlemen, we want to take a quick break, and of course we continue to bring you this special coverage as the country prepares for the COVID-19 vaccine here on Front Row. We'll be back after this quick commercial break.